So my name is Kezi Jones. I am a public health professional and I have been in the field now for 10 years. The day in the life of a public health professional, speaking specifically for myself, varies. I am a program manager at Mississippi Public Health Institute. I supervise a program aimed at reducing health disparities in African American and Hispanic women in the state of Mississippi. And so we focus on 4 different focuses, that being nutrition, breastfeeding, physical activity, COVID and flu, as well as just adult immunization. So depending on what my schedule aligns with from the day, some days may be more administrative in the essence of I'm getting in invoices coming from different contractors or consultants that are partnered on the project, or it may involve tackling maybe some creation of some logic models or just different plans that essentially are tied to some type of initiative that we are about to get ready to launch, that focuses on those focuses, or it's being out in the community, which is my favorite part of my job, where I actually get to go out and be with other moms. I'm a mom myself, so it's always nice just being a part of the community. And being out could include a public health fair, or even just visiting some of the lactation support groups that we have in the community and we offer for free for the moms. It could also involve just networking, and being involved in a part of a meeting of another organization that maybe has the same alignment with maternal and child health. So it really just varies from day to day, which makes it very exciting for myself. I like not being stagnant and not kind of doing the same thing every day, and that's repetitive. So I absolutely love it. So the greatest piece of advice that I received when I was an undergraduate and just grad, and that I always extend out to learners in the field, is to be open-minded. One, the field of public health is so broad. I remember when I was an undergraduate, I had an idea of what the day-to-day work would look like, what was the exact population that I wanted to work with, or the work that I wanted to be involved with, and it has changed drastically. A second part of that would be network. Networking is so extremely important. I don't know if you guys have ever heard the saying of your network is your net worth. And that has truly been something that has been instrumental in my journey as a public health professional. Just making sure that you are being out in the community, getting to know the organizations that you want to possibly become affiliated with or just be a part of the work. Volunteering is another great trust building technique that we often use in the field as well. So being open-minded as well as just networking, get to know your professors, get to know anyone in your learning environment, because you never know what career opportunity may present itself and who works at that organization, and where things just may essentially come back tenfold. I always share as well, I was actually, my first job into public health was for the American Lung Association, and I interned for them. So I didn't get hired on initially after my internship, but essentially my preceptor came back to me a year later after graduation, and told me about a career opportunity that she thought that I would be perfect for. So making sure that you're showing up in your classrooms, you're showing up when you're just out in the community, as well as in your internships, doing your best work, because your first impression is always your best impression. So just make sure that you're doing the work. And the second part of that is, I'll say, of course, we know that we all have to, or the third part, sorry. Of course, we know that we all have to have funding and money to survive and live. But one thing that has definitely been true for me is that when you follow your passion, the financial part will come. Be patient, stay the course. Remember that you always have to start from somewhere. And honestly, in this field, it goes very fast. So essentially staying at a job 2 to 3 years, and then next thing you know, you're being promoted, or a secondary opportunity comes apart. So don't be discouraged by that first job offer. If it is in alignment with what you want to do and you can financially, take that, then definitely take that leap, get that experience, use it to build on to the next connection, because that has just truly been valuable.